I'm Dr. Desiree D'Angelo. I work at Premier Surgical Network and I am a general and breast surgeon. Breast cancer is a disease of the breast tissue. It typically presents in the breast first and then can spread to other places. Sometimes it can present just in a lymph node, which may be in the armpit or in the neck, but it is an abnormal growth of cells in the breast that has the potential to metastasize. Typically, the first sign of breast cancer is sometimes a lump in the breast. It may be a lump in the armpit or a lump in the neck that is different or new from what's been there before, because some women have lumpy breasts to begin with, especially younger patients. So this would be like a new change in the breast. Sometimes it can also be a change in the skin or a change in the nipple where there's like a crust or a scale, or now the skin is very red and swollen. They could all be signs that there's something going on in the breast. At Premier Surgical Network, where we come in the breast cancer diagnosis is sometimes a patient already knows that they have breast cancer, they've already had a biopsy somewhere else and they're coming to us to talk about the surgical management of it. Sometimes they are coming here with their abnormal mammogram or their abnormal ultrasound, and we are going to be doing the biopsy, either here in the office or sometimes at a hospital with a mammogram machine. So once we get a diagnosis of breast cancer, then we talk with the medical oncologist and the radiation oncologist and the plan of action of, do we need to have chemo first? Are we going to do surgery first? And then we talk with the patient about options of surgery, whether it's going to be a lumpectomy, is it going to be a mastectomy, are we going to have the plastic surgeon also see you, talk about breast reconstruction. And then once we have sort of a plan in place, then we execute that plan and we continue to follow the patients through all of their treatment and then for many years afterward. When a patient is diagnosed with breast cancer, it can be very overwhelming at first because there's going to be a lot of doctor's appointments and sometimes radiology studies that have to get scheduled, which can be, a lot for patients. But we do have a nurse navigator in our office that will help patients make those appointments and schedule office consults and make sure all of those things are getting done in a timely fashion so we can, get their treatment plan in place. With breast cancer treatment, there is surgery, radiation, chemotherapy where it's an IV chemo, or hormonal therapy where it's a pill afterward, and it may be all or none or some of these things. It just depends on each individual patient and their particular cancer. With breast cancer surgery, depending on the type of surgery that you have, the recoveries are different. So if you have a lumpectomy, which is a more localized surgery, your recovery is anywhere from a week to 2 weeks. Sometimes we do mastectomies with reconstruction, sometimes without reconstruction, and recovery from those can be a lot longer, sometimes 2 to 3 weeks, and then there may be a second surgery involved where we are going to do a staged procedure where we're doing your mastectomy with a tissue expander and then putting in an implant, and then that may be a second surgery. Depending on your cancer, you may have to have chemotherapy or radiation either before or after surgery, which leads into the treatment time and recovery time. I usually tell patients that breast cancer treatment is sometimes about a year between surgery, chemo, radiation. In a year, we're going to be back to normal. We're going to be back to our regular life, but it can take that long, the treatment process. Breast cancer can be a very scary diagnosis. Any cancer diagnosis can be scary. The good thing about breast cancer is that we have so many treatment options, and we are diagnosing breast cancer earlier and earlier, where we are, able to cure you of your breast cancer. And like I tell patients, it'll just be a memory. This is something that we did and it's over. Whereas other cancers, there may not be as many options. But with breast cancer, we have so many options. There's so many treatments out there, and we are frequently curing patients of their breast cancer. For patients that want to come to see a doctor at the Premier Surgical Network for a breast issue, typically we want you to have breast imaging when you come to see us. So that may involve you seeing your primary care doctor or your gynecologist and having a mammogram or an ultrasound or something before we see you in the office. But sometimes we see patients without their breast imaging and we'll send them for that breast imaging. It's very important for women to be getting their screening mammograms every year. That's how we're able to diagnose these cancers early stage so we can cure patients of those cancers.